Hi, my name is Alex Weintz with the public affairs firm Amber Integrated, and you're watching the first episode of Quarantine Corner. Quarantine Corner is our attempt at bringing people in Oklahoma informative, interesting, and useful information about what people in Oklahoma are doing during this COVID-19 pandemic. We're going to be talking to people on the front lines of the healthcare effort to limit and mitigate the damage done by COVID-19 that are working to save lives. We're going to be talking to business people about what they've done that is innovative to help their businesses during a trying time. And then we'll just talk to some people about how they've been personally affected. So I'm happy to say my first guest here today is Stephen Buck. Steve is the president and CEO of Care Providers Oklahoma. That is the association that represents skilled nursing facilities in the state. Obviously, that's an incredibly important job because we know that this is one of the most vulnerable populations, actually the most vulnerable population of people in the state that skilled nursing facilities are taking care of. Steve has just joined Care Providers Oklahoma about a month ago, so he's had a wild ride, joined just on the cusp of this pandemic and has been thrust into one of the most important roles. Steve, welcome. Thank you for being here, taking a few minutes out of your very busy schedule. And I just wanted to give you a chance to kind of introduce yourself, talk about how you got to Care Providers and what month one on the job has been like for you so far.
Well, Alex, thanks for having me. I enjoy this opportunity and I appreciate the chance to visit. This was not your ideal onboard experience, right? I mean, I think I was 2 days into the job. It was on the Wednesday after I started that the Oklahoma City Thunder and Utah Jazz game was played. And of course, that was noteworthy for our community and nationally because I think it was that moment that we broadly realized that things might be very different for a period of time moving forward. Really thrilled to join the organization. I had served in state government for 13 years. Most recently, I was the director of the Office of Juvenile Affairs and actually was serving as Governor Kevin Stitt's Secretary of Human Services and Early Childhood Initiatives. He had carried me over from the Fallon administration where I'd served as her Secretary of Health and Human Services. So those were jobs that I thoroughly enjoyed and I appreciated the opportunity to do that every single day. But the opportunity to do work for an organization like this on such an important cause and going to work every day and fighting for better services for our seniors, whom we have so much that we can learn from. They're such tremendous assets. This was a unique opportunity that I wanted to take advantage of.
Sure. So what do we need to know now about skilled nursing facilities, about the population that's in them? What are the challenges they're facing? What's the status of the world of nursing homes today as we continue down this COVID-19 pandemic trajectory?
Well, the residents that we serve in our skilled nursing facilities truly are the most vulnerable population as it relates to the potential negative consequences of a COVID-19 infection. We have seen through the literature, and it's proven out as this pandemic has navigated across the globe, that this is a population that is uniquely susceptible to very harmful outcomes. And we know certainly from experience here in the country that some of the research has suggested that for many seniors, when they have become infected, they present asymptomatically, which means they are actually at risk of carrying the disease and not showing symptoms themselves. So it's a frontline fight. We have brave men and women who work for our providers out doing work every single day to try to protect our residents. But we do know from a risk standpoint that if a virus is introduced, that we have a very significant challenge on our hands.
Yeah, and let's talk about that because you hear a lot, as you should, about how doctors and nurses at hospitals are, they're our equivalent of troops in this war against COVID-19, and so we have a lot of respect for what they're doing. But people at nursing facilities, your staff, they're essentially in the same environment in many cases, right?
They are absolutely in the same environment. And what makes this environment unique is, again, when you look at the literature, basically every resident would be considered to be at high risk. You're typically looking at age of 65 and then comorbid presenting medical conditions. So every resident that we would care for during the course of our daily rounds is going to be considered at high risk. And one of the things that's unique about skilled nursing is there is frequently interaction that occurs outside of the building to promote the residents' overall health and well-being. That may include a trip to the hospital to have maybe a fall or something like that looked at, or just for routine heart care or whatever it may be. And so you're doing your best to protect your facility, to make that your fort, if you will, but you also know that you're going to have an interaction with the outside world. I can tell you one of the most significant early actions that was taking place for those we care for, both at the presidential level and at the state level, was very, very significant restrictions on visitation. In fact, the only visitors allowed inside skilled nursing facilities at the moment are those family members who are at an end of life, a compassionate care moment. Outside of that, visitation has been completely stopped. And so it is a very unique subset of individuals that our frontline staff serve, but very, very important. And so they have to be on top of their game to provide appropriate protection and safety.
Right. And I imagine that's really challenging, telling loved ones, I'm sorry, but you can't come into this facility today to visit grandpa or to visit your husband or wife, right?
Yeah, I mean, I was really surprised, Alex, as we began to put these into place. I thought the uproar would be, we're being too restrictive, that we shouldn't be doing that. But I can't tell you how appreciative we have been at the understanding that family members have shown. And I really appreciate some of the innovation that has occurred locally. I know that we have our providers who are actively using platforms like FaceTime or Skype or maybe even Zoom as a way to facilitate continued engagement with families. Numerous anecdotes in the media of where a birthday was celebrated in a unique way or whatever the case may be. So connection to family is extremely important. It's important for the family. It's important for the resident. And I can't be appreciative enough for the patients demonstrated this far and the understanding of the importance of that action.
Yeah, that's wonderful. And it's great that there are opportunities with technology like this for people to still make those connections. So Care Providers has made some pretty specific asks of state government, correct, in terms of what you all want in terms of resources to fight this disease?
Right. Generally, those can be defined in three very specific policy asks. And then there's also the financial side of the ask. In the policy world, it's really three pretty straight propositions. Number one, earlier in the interview, I mentioned the fact that residents may be in and out of a hospital for any number of reasons. Well, as they come back from a hospital, it makes sense for us to have a unique facility established to provide services to those residents who have become COVID positive and are under treatment for that. Rather than bring them into a healthy population, it makes sense for them to be able to recover until the point they're no longer contagious in a place that's different. The second ask is to make sure that our frontline men and women who are providing these services have access to the appropriate personal protective equipment. We call that PPE. It's absolutely essential. It's been well documented, the challenges that our nation is experiencing getting adequate protective equipment. And for our frontline workers, it's absolutely essential that they be equipped with that. So we've been very consistent in messaging that we need those protective elements to be made available to our staff. And the third element of that is to make sure that before we do bring a resident back from a hospitalization, that we have the benefit of a negative test on that resident before they're brought back into a population that does not have infections. So basically, as you leave hospitals, there's this tipping point. If you are negative, you come back into the skilled nursing facility. If you're positive, then you would rehabilitate elsewhere until such time you're no longer contagious. So those three policy areas. On the funding side, these are extraordinary times. And for our operators, they are really having to ramp up their use of personnel because we ended communal dining, for example. Our operators are having to feed residents in the room. Well, that requires additional staffing time. They're also having to be in a regular continuous screening mode to where having to check temperatures and all of that. Those are staffing intensive functions. And then what PPE we have been able to purchase, it's skyrocketed in price. It is definitely well beyond what normal expense modeling would look like. So for our members, we're actively seeking a temporary add-on payment to meet this emergency from our Medicaid agency.
Sure. I can imagine the costs of trying to fight and contain this are just staggering. So I certainly hope that help is on the way when it comes to the state government. So we know
we desperately need it, and the residents that we serve, they deserve the very best that we can give.
Yeah, absolutely. So speaking of what we can give, I mean, we know what your ask is of state government. If I'm just a concerned citizen that wants to do what I can to make your life easier to help nursing homes, what can I do?
Well, certainly I would encourage you to talk to your policymakers. We know as this moves ahead for hopefully a short period of time, but certainly it's going to be a matter of at least a few weeks, probably months. Engage with your policymakers however you can. If you have an ongoing relationship with them, you connect with them regularly, make sure you underscore the importance of providing the services to the residents that we care for. And that includes making sure that those tools that I talked about earlier are available, both in the protective equipment testing as well as on the financial side. So in your rhythm of life, I encourage you to do that. But I would also encourage you to do this. We know that not all of our residents have family members. If you have a few minutes, drop a friendly postcard to a local skilled facility that you might have knowledge of. If you don't know of any, call us and we'll connect you with one. One of the things that has impressed me in these early days is I have been really impressed how people are finding new ways to do connection. They're really old ways. It's what we used to do all the time. But whether it be the modern video platform or just a simple letter, let people know that you're thinking about them and care about them.
Yeah, it's amazing how much that human connection makes a difference. And just hearing, even a total stranger say, chin up, we're going to get through this together. We hear anecdotes from all sorts of industries, and certainly healthcare workers and people in nursing homes could use that kind of support. So that's
absolutely.
Steve, I think one of my last questions here is about the catastrophic health emergency plan. Governor Stitt, there is a catastrophic health emergency plan. He recently used the powers of the Catastrophic Health Emergency Act, I believe, essentially to trigger that plan. It gives him and the Commissioner of Health sort of unprecedented power to do things on behalf of the state to fight COVID-19. You helped to author that plan, I believe, when you were in Governor Fallon's administration, correct?
That's correct.
Can you kind of give us the Cliff's Notes of that plan? Tell us what we can expect, what's different, and why it's necessary?
Sure. Well, first, let's go back to the act itself. I believe the act was passed in the early 2000s. And the reason for the state putting this on the books was that was in the days following 9/11. And you might recall during that period of time, I believe there was significant concern about anthrax and other agents. And so the legislature, which happened in many states across the country, decided that they wanted to put in place a mechanism by which services could be delivered should we face a catastrophic health emergency. Up until this point, the plan had never been enacted, or the authorities given to the governor had never been requested and fulfilled. And it's timely that we're doing this chat today. Just today, the House and the Senate confirmed the catastrophic health emergency, so it's the first time that it has been enacted. Now, what the catastrophic plan is, which I believe we signed off on in my final month of service to Governor Fallon in 2018, what the plan is, it basically becomes our playbook, Alex. We think about, to use as a parallel, a sports team, a football team, they have a playbook where they go in and they have the script of what they want to be able to do to attack the challenge in front of them. Well, this is no different. The catastrophic health plan basically represents our playbook. It gives us the elements of things that we want to have into place as far as here's what the Department of Health will do. Here are specific regulations that we need to put aside. Here's how we're going to communicate. Here's how we're going to allocate resources. So it creates this minimal playbook. But just as the case in a football analogy, your playbook is altered based upon what you're seeing in your opposition. The same would be true here. So we have this basic playbook that's available to the governor. It's available to Commissioner Cox. They will take that playbook. They will adopt it to the unique needs that are presented by COVID-19. But that will be the baseline, if you will, for our coordinated response.
Now, I know the governor is considering some new rules that would make it easier for skilled nursing facilities to hire new staff quickly. Is that an example of the kind of rulemaking power that the governor or the commissioner of health might be given under this act?
It's very illustrative of that point. In fact, this is kind of breaking news, but I understand before we got on the chat together that those rules have been signed today, so they'll soon be posted by the Secretary of State. But it's that example of looking at an existing regulation that is very structured in how we're to do certain things. In this case, it's the training of CNAs. And the governor, using his authority, is able to alter those rules in order for our providers to be able to handle and recruit additional staff members during this time. Early in our talk, I talked about the additional pressures as it relates to staff and all the functions we are having to do. In-room dining, additional temperature checks, things like that. We will now have a pathway forward by which we can train and certify those individuals to help answer the call in this battle.
That's great. And I just read the rule quickly, but I think Governor Stitt made a good point in drafting it, which is if you're going to only allow people to hire people who have achieved some level of certification or official training, but those training programs aren't available because we're all under lockdown, then you're essentially grinding the hiring process to a halt at the exact moment in time when you all need a greater level of assistance and staffing. So that sounds like an excellent example of the kind of bureaucratic red tape that you need to be able to kind of carve through at a moment like this.
Absolutely, and it forges itself for innovation. I know that our national trade group, ACA, has actually created an 8-hour online training, and so that will be available, and then our facilities can do 8 hours of internal training. People are still going to be expected to meet a training mandate. It's just they won't be doing it in remote classrooms that required seat time previously. They'll now be able to do it in a more responsive, innovative way.
Makes sense to me. Well, Steve, I want to let you get back to managing this rolling crisis and protecting our residents. So I'm going to let you go. But before I do, is there anything else I didn't ask you or that you want to share with the general population or lawmakers or anything else that we should know about skilled nursing facilities or COVID-19 that we didn't get to already?
There are two really strong points, and really I'm going to be reiterating a couple of things I said earlier, is we owe a debt of gratitude collectively to the frontline health workers at this time. And I don't think we can overemphasize that. Of course, in any environment, there's a lot of things that get politicized, and I understand that. One thing that should not be politicized is the standpoint that we have men and women who are doing extraordinary things every single day, serving in our healthcare community. So let's always keep a focus on that. And then the second element is this. The population that our skilled nursing providers serve are an important population for our state. There is so much wisdom, and there is so much knowledge, and there's so much lessons learned that we can gather from these people who have done so much for our communities. I mean, these are our grandparents, these are our parents. We need to honor them by giving them our best. And any way that anybody who's viewing this session can help influence that, whether it's a note of encouragement or an affirmative word with a lawmaker, that would be greatly appreciated.
Absolutely. I don't think you can argue with that. And as you said, it's not a partisan issue. In fact, the only people I think who are going to question you, Steve, are OU fans if they're looking over your shoulder at Pistol Pete there.
Well, we talked earlier, I've only been on board for not even a month yet. I do have an OU diploma. My graduate degree is from OU, so I will have to somehow even that out a little bit.
Okay. Well, I guess no one's perfect, but you seem to be doing a near perfect job at Care Providers Oklahoma. And I know I personally am really thankful that we have experienced people like you, people with government and private experience, and a lot of knowledge about the different levers of power there are to pull to help our different vulnerable populations. So thank you for your service, and certainly thank you for taking a few minutes out of your day to do this today. I really appreciate it.
Appreciated the invitation. Thank you, Alex.
All right. Thanks, Steve.